Blepharoplasty left asymmetry on upper eyelids, more than 1 year old. How can this be corrected? It's been over a year since I went through this procedure, and the look is very asymmetrical. I want my left eyelid to look as my right. It looks hollow and ugly compared to the other one. I've been told I could fix this with hyaluronic acid. Would this help? If not, what else can I do about it? What do you recommend? Thank you.
Thank you for your question. You submitted your question with some photos, and you describe in the details of your question that you are more than 1 year out since having upper eyelid surgery, and that you are concerned about one eye looking more hollow than the other. And you're asking about options, and you asked a question about whether or not hyaluronic acid could be of value in this situation. Well, I can certainly share with you my perspectives on situations like yours, which come to our attention a fair amount in our practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I have helped a lot of people with their eye aesthetics, with upper eyelid surgery, lower eyelid surgery, and further, patients come here from around the world for me to do revision procedures to help them with complications of eyelid surgery, or just a desire to improve the outcomes of eyelid surgery done elsewhere. So to begin with, it is worthwhile, of course, for you to discuss this with your surgeon. I think that your surgeon can help you with reviewing your before photos and see what exactly was the level of symmetry or asymmetry prior to surgery. It's important to recognize that each side of the face does have a slightly different bone structure, and that does have often an impact on the outcomes of eyelid surgery. Now, that being said, there is a certain assessment that I do whenever I see a patient like yourself. And the first thing I want to assess is how much skin is there to work with in order to add some volume. Prior to the hyaluronic acid fillers, for patients such as those who had Asian eyelid surgery and had excess fat removed, I routinely did fat grafting. Fat grafting did come with its own many challenges, one of which was its difficulty to predict because of the absorption of some of that fat. And so it was routine for someone to get more than one procedure. Move the clock forward, my treatment of choice in a situation like yours is to use a hyaluronic acid filler. Now, there is always this desire to get as close to as symmetric as possible. But as you get towards that inner corner and then towards the inner aspect, there is essentially almost a space called it's called the orbit, and when you place volume in there, you have to place it very carefully, otherwise it just ends up behind. But in the area as you get towards the center of the brow is an area where you can go under the skin of the brow and add volume so that you can create a little bit more symmetry between the two eyes. And generally speaking, I like using a hyaluronic acid filler to do that. It's fairly straightforward. It's done with a little bit of local anesthesia, and I think it is likely to be a strategy that can be of value, especially since once you get it done, you might appreciate that the eyes look more symmetric, and it's something that you may do periodically. A lot of times these fillers placed in this space can actually last a fairly long time. Some people it may last as little as 6 months, and other people it can last up to a year. It's just a matter of seeing what it is for you. But I think that as a strategy overall, a filler can probably get you closer to that symmetry with some predictability and minimal disruption in your normal routine. So again, I would really advise you to speak to your doctor about this, review your photos. A lot of times, as I said earlier, people don't notice their asymmetries until after surgery. But if the asymmetries existed before, at least you have a sense that there was a certain amount of asymmetry and your surgeon may have tried to balance it out. But if there was already some hollowness there, well, there's still, of course, an option to help, but at least you'll get some perspective as to the difference between the two eyes prior to surgery and currently a year after the surgery. So I hope that was helpful. I wish you the best of luck. Thank you for your question.